developmental screens have the intent of getting a lot of information in the short time period that pediatricians meet their patients. You know, you only get a snippet of an assessment that's very skewed oftentimes when somebody's in the office for a 15 to 30-minute visit. So as a result, if the child's having a bad day, you're not really going to get a strong sense about the child, be it close to newborn, a 2-month-older to a 21-year-older. So you need screens and tools to help you out, and it takes a little time to do some of these screens. Some of the screens are online that they can do. Other ones we can't put online because the copyright laws with it. These screens are standardized and have been rigidly tested and validated, so it's not like these are just things that we make up. However, Westwood-Mansfield Pediatrics does make screens for things that have not been standardized yet, but we feel are very important for patient care. Sometimes as pediatricians, we like to pride ourselves on we can sense when there's a problem in somebody developmentally. But to be honest with you, in my 25 years of experience, there are still times I won't pick up the subtleties that a screen will. And unfortunately, these screens are still slow to be used in some parts of the country. And because we have some reimbursement for these now, pediatricians are using this very, very valuable tool to help their patients. Our first developmental screen is called the PEDS. This goes till 5 years of age, starting at birth to 5. And this is really a screen that asks the parents, what concerns do you see developmentally in your child? This is kind of an active way of making the parents think about what are the concerns or problems your kids have. Most of the time, for most kids, there's very little concern. But there are times when there can be potentially significant concerns, which can be focused and addressed upon quickly in a checkup, because development is central in a child's health. Most of the screens that are available now for screening for autism are down to age 18 months. This is a screen that was developed by Dr. Barry Prezant, who then the University of California, San Diego took this screen and started to give it to the 1-year-old. Its major purpose is to screen for autism. It can screen for other developmental issues, but the major purpose is to screen for autism. It's called the CSBS, which is the Children's Symbolic and Behavioral Screen. This was developed in Britain years ago, and we've in fact been doing this screen for almost 5 or 6 years. It was only mandated a year and a half ago by the state. Now the reason that Westwood-Mansfield Pediatrics started to do this earlier is because we were noticing a lot of parents transferring from other practices when their kids are between 18 months and 30 months. And oftentimes it's because the child had what was called expressive language delay. And as a result of that, there wasn't the process of looking a little more closely where there are other things like social issues, like eye contact or compulsive like spinning and things like this. And the problem was many pediatricians, myself included at the beginning, were saying, don't worry about it, don't worry about it. Because language, expressive language, has a broad range of when kids really start to talk. It's the receptive language that's key. We don't always measure that well. And that's where the MCHAT helps out. And these kids can be picked up as early as 18 months. Whereas years ago, parents were transferring, because they were frustrated with pediatricians, around 2.5, because they thought their kids were having trouble till 18 months. And the pediatrician kept saying, don't worry about it, until they were about 30 months. Nowadays, in Massachusetts, that should happen far, far less, because we have the MCHAT. And people should be screened with this very valuable tool. I, in a sense, call this one the Temperament Screen. It gives me a sense about whether the child has a high needs temperament. This is called the Pediatric Symptom Checklist, or the PSC. This gives me a sense how challenging this child is. And high scores in this oftentimes warrant discussion and a possible referral for therapy or some kind of other developmental screening as well. ADHD can be in that, learning disabilities, behavioral problems. This call can address that as well. So that's why the Pediatric Symptom Checklist was developed by Dr. Jelnik at Mass General and has been standardized and used across the country. They have an excellent site if you ever want to look at developmental screens called schoolpsychiatry.org. And it has lots of other screens as well as some of the screens that we're talking about today. One other standardized screen that we have is called the SCARED. The SCARED is a standardized screen for screening for anxiety in children. And the parents and the children answer the same questions separate from each other. They should not be discussing this themselves. And then oftentimes parents will learn things about their children that they didn't even know, and that's why this is valuable, because the children do it independent of the parent. And what I'll do oftentimes is hand it to the parent. There are sometimes a difference in scores most of the time that are very small. If anybody scores over what we call 25 points, that's considered significant for anxiety in kids. Now, I've had parents on occasion that have extreme differences. I had a child who had 63 and a parent had 10. And it's very interesting to give these to the parents, because then they, in fact, may learn something, parents may learn something as well about your child you didn't know. So this can be a very helpful screen, and we have packets on anxiety, and we also have referrals. And I think anxiety has gone up significantly in our culture as a result of the fact that kids get so much information thrown at them so quickly nowadays, between internet, Twitter, IMing, and all this. There's a lot of information being thrown at kids, and they can worry a lot more because they're hearing about disasters and things like that as well on the TVs. Is the Edinburgh, which is a postpartum depression screen for mothers. We give 2 and 6 months, and this can be very helpful. And then finally, the last one, we were doing this 5 years beforehand. This is called the PHQ-9, which is the Patient Health Questionnaire. This is a depression screen. We started at age 12 and can go on until 21. This was actually developed by the New York Health Department. We started this 6 years ago with college students, and in fact, in the college packet, these are in the packet for the college students. And I try to emphasize to them that you can, because probably 20% of kids go through a major depression their first year of college, and they can screen themselves for this and see how severe, if they have depression, or how severe it is, and be able to go and talk with somebody at the infirmary or the mental health part of the school. So this can be a very, very valuable tool as well. So as you can see, these tools help us to get more information in the small time period that we see with kids. We hope that people see the value of this and take it to heart, that even though sometimes parents think their kids are perfectly healthy, they suddenly find out something new about their child they didn't know. And that's the value to the visit to coming to the office at times. One other thing I just want you to keep in mind about the values of these screens. The average pediatrician, when I polled our office, pediatrician and nurse practitioner, asked between 25 and 40 questions total on a checkup. We don't have time to ask more than that. When we ask you these forms, and hopefully many of you will do them online when you can, because it will save a lot more time. We would really appreciate it if you do it online. We have asked you roughly 128 questions. How much more thorough a physical can you have, a well checkup in your child, to look at their wellness and what can improve their wellness than by doing screens like this that are standardized and endorsed? Thank you again. This is Dr. Hartman from Westwood-Mansfield Pediatrics, proactive in your child's care, empowering parents and families for over 50 years. Thank you.